two here that we talked about also this week. Does this look normal? Down here?
No.
It's a little dense, yep.
It's non-homogeneous increase in density. What would best describe this pattern? Is it nodules?
Tibby.
Is it reticulation? It looks more like branches, doesn't it? Looks like a real extensive spider web. And it looks like maybe somewhere up in here it kind of stops. You see that? It doesn't go all the way up. We don't have this going all the way up to here. We don't have it here going all the way up to here. It kind of stops somewhere in here, somewhere around the hilar areas it kind of stops.
Dr. Fox, is it on both sides? Or?
Yes. It's a little more visible on this side, but it's on both sides. It's on both sides. This is the basal fibrosis thing that we were talking about. And basal fibrosis has a variety of causes, but there's some ones that we always think of first. And there's really two things that come right up to the top of the list: asbestos and rheumatoid types. Asbestos and rheumatoid type disorders. For basal fibrosis, those are kind of, they come right up to the top immediately. If it's a male, it goes to asbestos. If it's a female, it goes over to rheumatoid types. Just because that's most likely the patients that are going to have it. We talked about the fuzzy, shaggy heart sign with asbestos, didn't we? This is asbestos lung disease. And remember when we looked through the PowerPoint, does it take, which one takes more exposure? Asbestos lung disease, asbestos pleural disease?
Plural.
The pleural takes less exposure. The lung disease takes more exposure because you've got to embed more of it in the lungs. The pleural disease comes from, you know, the stuff just, it's buoyant. Remember, we talked about these particles are so tiny, and so it embeds all the way deep out in the periphery. And they get carried, big orange, out to the pleural surface, and that's what causes the pleural disease. And it doesn't take anywhere near as long to get that as it does to embed enough into the lungs to get this happening. It takes more asbestos exposure to do this than it does to do this over here. See, we talked about this in class. Remember that pleural plaquing? That pleural thickening, remember the angles we talked about?
Mm-hmm.
Obtuse, down here, see it? Obtuse. That means it's external, it's pushing in this way. We'd get acute angles. It'd be like this. That's an acute angle with the chest wall, here, versus this. See, that's obtuse. That means it's pushing in this way. Chest, you know, lung lesion is going to have an obtuse angle up against the chest wall. If it's obtuse like this, it's external to the lung. Well, this is visceral or parietal. We don't know which one, but it's thickening of the pleura. These are what are called pleural plaques, and that's what asbestos pleural disease does. It also calcifies the pleura. It's very subtle. There's a linear calcification right there. Can you see it? It's very subtle, though. That's just that very faint white line right there. This pleural calcification. I can't really tell. It's hard enough to see it on that one. I can't tell whether there's any on this side. So this is just below the top of the diaphragm is all that is. That little bit of linear calcification. And remember we said it's pathognomonic when it's over the surface of the diaphragm. This is the precursor to mesothelioma. This is. That's the precursor to asbestos lung cancer from the lung disease. Mesothelioma comes from the pleural disease. And remember, it takes less exposure to do this than it does to do that. And it doesn't take anywhere near as long exposure. This patient could have been exposed to asbestos for a couple years, 20 years ago, and no exposure. Remember that latent period? And that latent period can go out 40, 45 years from the time of exposure. And they do not have to be exposed continuously. Silica, they do. Silica takes 20, 30 years of daily exposure. 8 hours a day, 5 days a week. This does not. This could be somebody that has that auto mechanic case that we looked at, which is, by the way, the one on the end. You know, he may have worked for several years doing that, 20 years before his mesothelioma started. That's the latent period that's talked about. And that's unique to asbestos in the pneumoconioses. The only other one that has the latent period was beryllium, but beryllium had an acute phase. This doesn't have an acute phase.
Is there a certain amount of time that you need to be exposed to asbestos, or is it just one thing?
Generally, it takes some regularity of exposure, a couple years, but not 20 or 30 like silica takes. So much less time of exposure, but no acute reaction. The only one that was acute was beryllium. Beryllium had a latent period also, but you had acute and then no exposure, and then 20 years later the scarring starts, or 5 years later, because it was highly variable. Asbestos can go out 45 years. That's why we're still in the asbestos, and that's why we still hear about it. That's going to start dropping off probably over the next 10 years or so.
Do you get a latent period with that type of?
Either one.
Either one?
Yep,
Okay.
either one. Yep. So a patient like this can start having dyspnea 25 years after they worked with asbestos.